Welcome back. Beatrice Politi joins us now with health news. Heart attacks leave psychological scars, but they also leave physical markers of the heart attack. It makes the heart weaker. There really hasn't been a way to undo that damage until perhaps now, where Toronto doctors are hoping they have found a way.
Indeed, they are hoping, and they're hoping that that hope lies in stem cells, the patient's own stem cells. Toronto doctors have performed the province's first cardiac stem cell transplant in the hopes of taking that damage away. But first, a warning. Some of the video you're about to see may be disturbing for some.
You see the marrow, it's looking nice there.
What it takes to heal a damaged heart might be in this syringe. Right now, it's bone marrow taken from the hip of a patient about to go into coronary bypass surgery. That bone marrow is filtered and cleaned. What's left is this, stem cells, in this tiny bit of liquid.
In this case, we had 2.5 million stem cells that we diluted into 2 milliliters.
The solution is then injected into damaged parts of a patient's heart.
The cells that we implant may then be able to improve the function, squeezing ability, and the blood flow of that part of the heart where the heart attack was. The stem cells were injected into this area here, and you can see that this part doesn't squeeze very well.
How do the stem cells work? By getting the cells that survived in the heart to work better and harder.
Partly by secreting some compounds that act on the surrounding heart muscle cells. They may actually recruit other cells, including other stem cells, to the area of the injury as well.
James Culross is the first Ontario patient to have a cardiac stem cell transplant.
That was great. I really did, because you could take part of your body and fix one other part of your body.
It's important, as heart attack patients are at a higher risk of heart failure. When that happens, the average life expectancy is about 18 months for men and 3 years for women.
We know that simply by doing bypass surgery, we will make these patients better in a variety of ways. So now what we need is to demonstrate that the cells achieve some impact over and above that of bypass surgery.
The reality is, at this point, there aren't enough heart transplants and mechanical hearts for people who need them. So if the stem cells were to work, it could help tens of thousands of Canadians who are diagnosed with heart failure every year. The worldwide trial has Canadian sites in Toronto and Montreal.
This is groundbreaking if it actually works, but it's still experimental. Okay, first of all, you get the stem cells from the patient's own bone marrow, so there's no rejection.
That's right.
That's a big plus. And secondarily, congestive heart failure is often the terrible outcome of surviving a heart attack.
Absolutely, and the life expectancy for men is 18 months, and for women it's 3 years. So it's one of the most serious health issues you can have.
All right, this is very exciting. Thank you, Bea.
You're welcome.